Start recording, that would be great. Thank you. Today with us, we have Ms. Esperanza Colio, Deputy CEO, who will be talking to us about a program. But for now, we will get started with the regular COVID update, and then we will pass it on to her. And so welcome to today's community forum. My name is Janette Angulo, and I'm the Imperial County Public Health Director. And our numbers, COVID-19 test numbers are looking like this today: 120,165 tests conducted. And this is for Imperial County residents, 24,865 cases. And we've reported 688 deaths as of this morning. Imperial County is still in the red tier. We are happy to report that our neighboring counties are also now in the red tier. When it comes to metrics for Imperial County, we are looking at a 5 adjusted case rate per 100,000 population, a testing positivity of 2.8%, and a health equity quartile positivity rate of 5%. So we're getting closer and closer to the orange tier metrics. This dashboard we deployed earlier in the week. Total doses administered, and this is COVID-19 vaccine administered to Imperial County residents, includes 40,261 doses. Close to 29,000 Imperial County residents have been partially vaccinated. Fully vaccinated, a little over 11,000. When you look at it as a percent, it's 15% partially vaccinated and close to 6% fully vaccinated. And you'll see the breakdown by city there, as well as by age group, gender, race, ethnicity. We hope to enhance this dashboard as time goes by, and this information is gathered from a state system. And faces and tiers. We've added some new tiers into our schedule. More recently, those that you see at the very bottom, March 15th, we started vaccinating those 16 to 64 with certain health conditions and or disabilities. We also started vaccinating those in congregate living spaces, those that work in transportation and logistics. And we continue to vaccinate those in healthcare, those in emergency services, education, childcare, food, and agriculture, as well as our seniors 65 and older, and those that live in long-term care facilities. Vaccine received and pending, 56,880 doses received, and that's first and second doses. Just yesterday, we received close to 5,000 second doses, and earlier in the week, another 5,000 or so, a little over 5,000, and to work with first dose clinics. And those doses are for all providers in Imperial County. And when I say all providers, it's those that are enrolled in the California vaccine program. Now, as far as pending to receive next week, Wednesday night, we received notice that we're getting 8,940 doses for this coming week. That includes Pfizer, Moderna, and the Johnson & Johnson vaccine. So highlights, a lot has been happening for sure the last 2 weeks. Lots of things have changed at a very rapid pace. One of our goals that we had established early on was to, get all these healthcare provider networks set with becoming a vaccination site, and that was to increase access in our community. So I'm happy to report that we have over 30 vaccine dispensing points in Imperial County. We have at least 3 local pharmacies that are participating in the federal retail pharmacy program, and they receive an allocation that's separate from the county allocation that we receive from the state. So they receive the allocation directly from the federal government. We have at least 5 provider agencies that are now live with MyTurn. They started taking appointments last week, and we started clinics this week. We have many more providers working with the MyTurn staff to get onboarded onto the system. Meanwhile, they have their own mechanisms. Vaccine providers have their own mechanisms in making appointments and making sure that the vaccine is being administered. We do have at least 3 vaccine provider agencies that are doing pop-up and mobile clinics throughout the Imperial County. And that includes one team that's made up of the National Guard and the public health team. And we travel throughout Imperial County. Currently, we are doing quite a bit of work with the farm working community. All providers at this time are vaccinating those that are 65 and older, 16 to 64 with certain health conditions and or disabilities, and all those that are eligible in the sectors, phase 1A, 1B sectors. And for public health department ran clinics or coordinated by the public health department, our efforts are focused currently because it's cool, the weather allows we're focused on the travel clinics, the pop-up clinics, the curbside clinics, the drive-through clinics. We actually have one going on this afternoon, and that'll be for the agricultural sector and the education sector. And it's a second dose clinic, and it's by appointment only. So once the weather starts warming up a little more, we will have clinics at a fixed facility, a fixed site. And the picture you see in the background, it's actually one of our clinics that we held within the last 7 days. We are out in the field immunizing our community. And where can the community find information about vaccine providers? One place to go is our public health department webpage. We have listed all providers by city, and you click on the tab and the drop down will follow, and it shows all providers within that city. Another option is to go to the state's COVID-19.ca.gov site, not only to look at places where they may be offering the vaccine, but there's a lot more information there, including data, statistics that the community may be interested in. So this is a great place to go. MyTurn, this is the direct page to the MyTurn system, and there's different languages there, and then you can check for your eligibility, and you can register to receive notifications. You can make an appointment directly through this system. And then the federal system, which is Vaccine Finder, you just check on or click on Find COVID-19 Vaccines. You plug in a zip code, and it'll show you where vaccines may be available in your community or within that zip code. Testing, we downsized our sites, so we are down to 2. We have the Brawley Senior Center that is still operating. That's the fixed site up in the north area, but we also have the mobile unit. The mobile unit is throughout our county, and that is the schedule for next week. And if you notice, we'll be in the El Centro area on Monday. On Wednesday, bright and early, 1 a.m., we're going to be at El Consulado de Mexico right down in Calexico. We'll be there from 1 a.m. to 1 p.m. We'll also be up in the north area, Brawley area, at Comité Cívico del Valles facility on March 25th, and then Friday at Hector Mario Esquer building, again back in Calexico. We encourage the community to seek these resources. They're at no cost. And then there's a mobile testing locator. The link is there. You want to know where the mobile unit is at, go through that link and it'll pop up the information. And a lot of conversation around youth and adult recreational sports. There's a lot of information on the COVID-19.ca.gov website about youth sports. And so those are interactive links. We're going to make this PowerPoint presentation available to the community. You can access the information at any time. There's a document that has questions and answers that may be very helpful. But just a few bullet points about sports. And why were sports allowed to resume? And it was a couple of reasons, and mainly because our conditions have been improving in the state, in our county, and there's a schedule of what's permitted, when you move from tier to tier, and I'm going to show that in a little bit. But like I said, conditions are improving, and we can, with the proper measures, limit the risk of transmission. There are some prevention measures that you still have to adhere to, including, wearing of face coverings, the physical distancing, and then limiting, certain types of activities such as competitions and tournaments. Currently in Imperial County, competitions are allowed between 2 teams. Now, in those sports that may be higher risk, parents and guardians need to be fully informed of the risks, of their minors participating in such sports, and so that they can make a decision of whether or not it's appropriate for their child to compete. Now, sports, the state of California classifies sports as low, moderate, high contact sports. And I'll show you the table of the low contact sports and moderate sports that may be played given our current stage. This is the table. So when we were in purple, we could only engage in outdoor low contact sports. But then if you have been following the youth sports guidance, it's been updated frequently as we learn more, and it's based on science. Updates are made to the guidance document. The latest was early March. And then earlier in the week, there were some updates to some questions and answers, and we are expecting actually additional updates later today to the youth sports guidance. But now that we are in the red tier, we can do outdoor moderate contact sports. And so there's the listing of all the sports. Now, there are some sports that are outside the red tier that are allowed, as long as there's certain measures that are taken into consideration by schools, if it's a school sport. And I'll talk a little bit more about that in just a little. A common question that we get is competition allowed? And like I said, competition is allowed, but it's only allowed between 2 teams. Exceptions can be made when you have some of the lower contact sports. And actually in Imperial County, about 2-3 weeks or so ago, we started with cross country, golf, swimming, track and field, and the local health department is not putting any additional restrictions. We actually allowed more teams to compete in these type of sports that I just mentioned. Another question we get is, are athletes or coaches able to participate in more than one sport at a time? The current guidance, and because we are still in the pandemic and because of the risk levels, the guidance has that they can only participate on one team over the same season or period of time. And that's because of cohorting and, again, trying to minimize risk and the spread of the disease. Another common question that we get is anyone allowed to watch youth or recreational adult sports? Currently, what's allowed is observers. Observers for youth sports are allowed, but they're limited to the immediate household members. And it's for the sole purpose of providing supervision. And it should be limited to a single adult, and there needs to be physical distancing and wearing a face covering and maintaining, like I said, those prevention measures that we've been sharing all along. And finally, what factors increase the risk of transmission while participating in sports? Well, the more people that come together, that mix and mingle, the higher the risk. We also know that there's increased risk if the activity happens indoor versus outdoor. If it involves, separating teams or playing with more than just one team, the risk increases. When there's no use of face coverings or the distancing is minimized, cannot be maintained, that's high risk. And as you can see, I think we all know by now that, there's the higher risk activities that we've been saying try to avoid, but if it's going to happen, these are the prevention measures. And that's why for some of the sports that are currently being played that are allowed in orange, tier, but they're currently allowed in the red tier, there needs to be certain measures. There needs to be informed consent from the parents so that they understand what the risk level is. There's one question that I didn't include here, and it was, is cheerleading allowed to happen in the sidelines? The reason I excluded that question and answer is because that is one of the areas that's currently being revisited, and there may be new guidance coming out as soon as this afternoon. So as soon as that information is made available by the state, we will be sharing that information with our community as to whether or not cheer will be allowed to happen in the sidelines. Currently, if you look at the state's guidance, it is not allowed. But again, the state is currently revising that guidance, and there's more to come, and we'll announce it to our community. And that's it. That's all I have for you today. We will take questions at the end. I will now pass it on to Ms. Esperanza Colio, and she has some information to share about a program.
Good morning. I'm Esperanza Colio. I think I know some of you. I'm glad that you're here with us. I have a presentation. Can you allow me to share this presentation that I have with me, which is this one? Very good. Okay. So I just want to clarify first something. As you may heard in the news, the government is making available several funding sources for different services for the community, especially for those individuals that were affected by COVID-19 and they continue being affected by COVID-19. And one of the biggest concerns in our community, besides the businesses, is the many renters, they are struggling with the rents to pay the rents, and they are actually delinquent. So the federal government developed this program that is called Emergency Rental Assistance Program, also known as ERAP. And so what they did, the federal government, they distributed funding directly to metropolitan areas, cities and counties with more than 200,000 population. And so they had a direct allocation going to them, and they developing the programs. But in a small community like ours, the funding has been sent to the state. And so the state put their own name to the program, which is the same program, and it's called California COVID-19 Rent Relief Program. And so I'm just letting you know, so because there will be news, and then you might get confused about, okay, so somebody's calling it ERA and somebody's calling COVID-19, California COVID-19. It's the same program. It's coming from the same funding sources. So the county of Imperial, so when this, let me go back. When the state of California received a portion, they received about $1 billion to distribute among all the small communities and small counties. And so what they did, they allocated $13 million to Imperial County. Now, I want to make sure then we all understand that the $30 million are not going to come to the county of Imperial. They're actually going to be available in an account at the state level. The Housing and Community Development is the agency, also known as the HCD, is the agency that will be managing this program. And so, but what they're doing now, they're coordinating with counties, and they offer us at the County of Imperial a seat on the advisory committee. And so they created this advisory committee to just to get an idea of what is the best way for us to reach out to those residents that are in need of this service. Reaching out also to tenants, to landlords, and see how can we spend this funding and how can we reach out every single person in Imperial County that might have a need for this funding. So what they're doing now, they contacted us as a county and asked us to encourage nonprofit organizations to apply to the agency to become a trusted messenger. And the way that they use this trusted messenger is the following. And you know, and maybe many of you know, people have the tendency to be afraid of the government. They don't know us well, so they're afraid of us, which we always trying to do the best that we can to assist the community, but they don't know that. And it is understandable. So what they do, they hire nonprofit organizations that are more trusted, and so they can go and distribute the information and reach out to that community. We, as a county, we have been encouraging those nonprofit organizations to apply. So how the program is going to work? The program is available to landlords. They have tenants with delinquent rents. It also has the funding available for tenants directly, but it has to, the tenant must be low income and it has to be impacted by COVID-19. And I highlighted impacted by COVID-19 for the following reason. You have to show proof that you have been impacted by COVID-19. That's what is called California COVID-19 Rent Relief Program. And I'm in your screen, you'll see income eligibility. And I put it over there. This is the one that was approved last year, April the 30th. New income limits are going to be available in the next month. Usually it's once a year that they change the income eligibility for the state of California. Imperial County is median income is 70,700. So everyone to become eligible for this program must be below 80% of the median income, which means that you see the highlighted areas in yellow. So let's say a family of four, median income, they had to make less, 80% less the 70,700, which means $55,500 is a person can become eligible for this program. And I want to make sure that maybe I'm confusing by having the highlighted median income, but I want to make sure that everybody sees it. This is our median income. So everyone below that median income that you see over here, this group, this is the group that is eligible, depending on the size of your family. So if you have a 6-member family, you eligible, but you cannot make more than 64,850 total household income. So if you only one person, you can make up to 39,150. So that's the eligibility for low income families. But you also have to show that you have been impacted by COVID-19. So let me go through the next slide. So the website, which is, you're gonna have it available at the end of the presentation, it gives you like a bullet points, 3 boxes that you have to check. If you check these 3 boxes, that means that you're eligible for the program. So number 1 is, are you struggling financially with assistance for and looking for assistance for rent? And it has to be a resident in Imperial County and California. So if you have a residence in Arizona, somewhere else, you're not eligible. You have to be a resident in California. Number 2 is that you have suffered, either you were let go from your job because you had the store has to close, or you were like many restaurants, they still operating, but they only do delivery. So the hours of the workers were reduced. So that's another way to prove that you have a hardship due to COVID-19. The unemployment has to be between April 1st, 2020, all the way to it has to be beginning April 1st, 2020 to become eligible for this program. Now, if you can also prove that you have either a risk of becoming homelessness or housing instability, meaning because you failed to provide your rent or you are about to become homeless, then that's a proof that they're going to need from you to be eligible for the program. So if you have checked all those boxes, that means you're eligible for the program. And I will have this information, this same presentation in Spanish for those who may need it later on. Now, how the program works. Landlords, for example, let's say, for example, housing authority. Housing authorities are eligible for this program. They are landlords, they provide housing to low-income families mostly. So the families, in order for them to apply, they can submit the application, and I'm gonna walk you through the website. There's a resource center for landlords and there's a resource center for applicants, the tenants. So as long as they are willing to waive 20% of the unpaid rents, and I wanna make sure that we all understand unpaid rent. And a landlord can get up to 80% of delinquent unpaid rents, um, as long as he or she away the 20% unpaid rent. So for example, someone who, let's say I owe my landlord $10,000 during this particular period, April 1st to March the 31st, 2021. And I didn't make any payments. I owe the $10,000. The landlord, by applying and waiving the 20%, the $2,000, he can get paid 20%, $88,000 out of the rent that I owe him. And so that will clear my account. Now, there will be instances, and the state knows this, that some landlords may choose not to participate in the program. And by the way, the rent goes directly to the landlord. It doesn't go to the participant. And in this case, the second bullet point is for renters like me in this case that I didn't pay my rent. So let's say my landlord doesn't agree to waive the 20% of unpaid rent because it might happen. So what this, I still able to apply, but I'm only gonna get 25% of the unpaid rent that I owe. So it's much less, but at least it's something. And that payment will come directly through it'll come directly to the landlord, the 25%. The funding never goes to um, the renters. Usually goes to the third party agencies. So the other one, eligible renters also will continue receiving assistance besides the period that I mentioned in the first bullet point, April 1st, 2020 to March 31st, 2021. So I'm as a renter, I can continue applying for assistance to continue paying my rent for the next month for 25%, up to 25%, but I'm also gonna be eligible to pay utility services. And utility services is still in the process to figure out how they're gonna work on the program, but it's already available. So actually you can go into the website and start applying. They're gonna review your data when they're doing it at the same time, all the information, all the programs, they're working together by hiring these nonprofit organizations as well. So it's a lot of work going on. They're trying to push as quick as possible this program so to prevent evictions. And the reason why is because evictions, the moratorium for evictions ends June of this year. So they're really trying to push for this program so nobody become homeless. And I hope that makes sense. So, sorry, no, I didn't want to do that. Hold on one second. I hit the wrong key. So as I mentioned before, there will be local assistance through the local nonprofit organizations. We have invited several nonprofit organizations to participate in the program. And I'm just putting some names over here of some of the agencies that already apply. And I want to thank those organizations because they're not even think twice. We just send an invitation on the 16th, and by the 18th, they will already submitted their application. The state continues receiving applications for those nonprofit organizations that are willing to participate in the program. So some of the activities that you can participate is one, you might be able to only distribute information, use the social media, things like that. But the technical assistance has been the hardest one because technical assistance is basically having your laptop, going into the community, show them where to apply. And we know that in this community, the unincorporated areas like Palo Verde, Winter Haven, Salton City, Ocotillo, those areas are very hard to reach. We had that experience during the census 2020, which I was, the county was the lead, and I was working with the nonprofit organizations. And without the nonprofit organizations, I don't think we will be able to accomplish what we accomplished by reaching out to every single point in Imperial County, all the communities in Imperial County. So the tier 3, which is the most needed service, we had to have bilingual people with computers or laptops. They can go into the communities and assist those residents that are in need for the services or talk to the landlords as well. So I just want to commend those agencies that already apply. We have been receiving emails back and forth. Very happy to hear that two more nonprofit organizations are coming also is Spread the Love and Calipatria Little League. They're submitting their application as well. So we're very happy to have so many agencies that are willing to work in our community. Now, where to apply? So the website is called the Housing Key, and I'm going to show you right now the website for those nonprofit organizations. They might be interested in becoming part of this effort. Remember, we have $30 million to spend, so we want everybody to advocate to spend those funds. The state is allowing a budget to the nonprofit organizations to participate in the program by doing promotion, or by walking on the streets, distributing flyers, whatever you want to do to assist the program to bring clients, eligible clients. They're willing to do a contract with you. The application, my understanding, is a very simple application. It only takes like maybe 2 or 3 pages that you can complete. The key part for the tier 3, which is the technical assistance, is a little bit more complicated, but I have the budget template that I can provide so that you can work on your budget and you can submit an application. Residents and landlords can apply directly by this website, as well as the call to 800 number. Now, if I can get out of this one, hold on one second and let me show you something that I have over here. And I did it before I came into the meeting. So let me see if I have it over here. There we go. So this is our website. And the website is very, very simple. I'm a landlord or I'm a renter. But also, if you want to become a partner with us, here is the application. Here's where you can apply to become a partner. And just to give you an idea, the local partners on the top, this is for all the other counties. They already have their nonprofit organizations.
Esperanza, I'm gonna interrupt you. I don't know if everybody else can see the screen. I can't. You ended your show, but it doesn't show. I think you're trying to showcase an internet site.
Yes, I'm sorry.
Andrea, can you see the site or?
No, I cannot.
Oh my goodness. How can I share this then?
Go ahead and stop screen sharing and then screen share again. And
okay.
You can specifically click
I
on
think it's this one.
Browser.
That one?
Yes.
We can see it now.
Okay, I'm sorry. Let me go back then. Okay. So this is the website that I was mentioning at the last in the last part of my presentation, as the Housing is Key. And then it's very simple. If you a landlord, this is where you click. And if you're a renter, this is where you click. And all the information is there in English and Spanish. You can click the Spanish version over here. And you can have all the flyers, all the information, all the checklists and everything is there in Spanish as well. And so now, for those who may want to be part of this group as a nonprofit organizations, here's where you go, partners, resources. And so over here, you can see all the nonprofit organizations that already had a contract with the state. We are in the second other partners. And if you're gonna see over here, it hasn't been updated because my understanding is Comité Cívico was the first one to get approved for tier 1, which is more like a distribution of information, but tier 3, they also apply, and we have 4 nonprofit organizations that have been approved as well, but they haven't updated the website. So if you are interested in becoming part of this big effort, very noble effort, I have to say this because I really feel for the families that are struggling, you can become a partner over here by clicking this box. And it will take you to the application, which is not that difficult. It's a simple application. But if you need additional information, please contact me. I will, I don't know if I have my email over here. I can put together my email right here. So it's Esperanza Colio. It's the same email that Janette and everybody in the county has, but the first part is Esperanza Colio all together, lowercase. You send me an email and I can forward to you the template for the budget, which is the most difficult part. But that's about it. This is the end of my presentation. I hope that I answer more or less. I can give you a better picture of the program, an overall picture of the program. I don't know if anyone has questions.
Esperanza, I don't know if you see just in the comments, WIC, they would like to reach out to you for a presentation. So
Yes,
you guys can connect.
I don't see the comments. Hold on one second. Let me see. Did I end my presentation?
And Esperanza and Andrea, I just emailed Ms. Martinez, and I included both Esperanza and Ms. Martinez in the email, letting her know that WIC is interested in a presentation. So I've already linked the two of you.
Perfect.
Hey, how can I end my share rights? I don't know how to do it, sorry.
Stop sharing. Andrea, I think we need your help here.
Yes. Stop sharing. Okay, I got it.
There we go.
That was difficult. I'm not a tech person. I am so sorry.
I'm not either. Thank you so much, Esperanza, for that valuable information. So we're going to open it up for questions. Questions in the chat. I think we've addressed them all. Mr. Campos was asking about, you know, our percent vaccinated and how this all started. The allocations per county were based off back in December. We've been only vaccinating for 13 weeks. So back in mid-December, the allocation was based on the healthcare population. And in Imperial County, we don't have as great a population as these bigger counties. And therefore, the bigger counties were getting a lot more vaccine than the smaller ones. And so eventually that changed when the 65 and older population was added. The state started including an allocation based on a percentage on healthcare and 65 and older population. The most recent change was the allocation is now based on 65 and older population plus the sectors. So education and childcare, food and agriculture, emergency services. And but not only that, there's an initiative at the state level that those counties using the Healthy Places Index that have been mostly impacted get an additional allocation, or the allocation increases. So if you noticed, not this past week, but the week before, we received an allocation of over 8,000 doses. That was our first larger allocation. And so for this next week, we're now expecting another shipment, and that one's going to be closer to 9,000 doses. So our allocation actually doubled from what we were receiving early February. And so, yes, we are hoping to, you know, get a greater percentage of our community immunized. How we're working our allocations is that we, as soon as we receive our vaccine, we have 5 to 7 days to dispense it. And that's how it's been working for the past few weeks. And it's a little challenging. I will say it's a little challenging when you only have an amount to work with week by week, because you can't do longer term planning. And the other challenge is we don't know how much vaccine we're going to get 2 weeks, 3 weeks from now. But providers have done an amazing job. Given those limitations, they still have made an amazing job in getting our vaccine out to our community. Other questions that you may have for Ms. Esperanza, Colio, or for me? No other questions? I don't think we missed any in the chat. Well, there's definitely a lot ahead of us. We are making progress in Imperial County. We're looking forward to moving into the orange tier. We just need to stay vigilant. We need to continue practicing all those prevention measures. We need to continue with that trend in our metrics, positive trend. And again, looking forward to moving forward as a community into that orange tier, hopefully in the very near future. Esperanza, anything you want to say or end with?
Yeah, so I just want to say this. As a grant writer, I've been doing this for many years. I was very excited about spending money that is not ours. But one of the challenges that we have in Imperial County is to reach out to the community, to the ones that are in most need. So I wish that everybody spread the word that there are assistance available for the family. Sometimes we reach out to the small communities and we find out that they don't even have a clue about the program. I'm going to be doing an interview right now, noon for channel 66, I think. And it was hopefully in the newspaper, but we're going to be trying to promote, go on Facebook and everywhere, because $30 million are available for us. We don't want our county of Imperial to lose that money, because whatever funding is not used in Imperial County, it'll go to another county. So we want to make our best effort, not just to spend the funding, but also to alleviate the stress of the families. They have no money to pay for the utilities or for the rent. It's I walk in the communities and I can tell you there's a lot of need. So please help us in spreading the word. If you need the information, let me know. I'll be happy to forward that information, flyers and everything that you need. Thank you.
Well, thank you, Esperanza, for joining us today. And I wish everyone has a wonderful weekend. Thank you all. Take care. Bye-bye.